Thank you. As described, we're talking about treating equine asthma and EIPH using shockwave therapy. And what I'm going to discuss today is based on two research trials that I've been doing over the past 2 years, looking at utilizing shockwave therapy to treat these diseases. And just as a caveat, the studies that we'll talk about were funded by Zomedica. So I think the first thing we kind of need to talk about is it safe? And the reason I bring this up is because I remember when I first started my internship in Arizona many years ago, they got a shockwave machine while I was there, their first machine, and we were told that it was not safe to shockwave over the lungs. This was based off some focused shockwave treatments they had done on children where the lungs had been damaged, but it's a different kind of shockwave. So I had some back issues. I still do, but I had some back issues then that I wanted to shockwave my back and see if it was better. And I remember I was really afraid that I was going to shockwave my back and blow my lungs up. So I had a few beers, shockwave my back, and lo and behold, it was fine. It didn't hurt my lungs. And so that was my first experience with, thinking maybe it was safe to shockwave lungs. There was a study performed at the University of Cordoba. It was not published. They took 2 horses that were slotted to be euthanized, and they did 2 areas that in anywhere from 1,000 to 3,000 shocks, and it was just focal. So they just put the probe at the highest setting in one area, didn't move it, and just shocked it. So those horses were euthanized, and on pathology, on gross pathology, there was no abnormal findings. The lungs looked normal, and on histopath, there was some mild hyperemia of the pleural surface. So pretty minimal effects there, even with just focused shocks. The current studies that we've been doing, I've treated at least 100 horses with at least 100 treatments, probably more than 100 treatments. We're using the highest energy setting, E8. And depending on the study, we're doing anywhere from 750 to 1,000 shocks on each side. And we have had no adverse events, not one symptom, not one evidence of lung trauma on any of the horses. So I'm pretty convinced at this point that shockwaving the lungs is safe. We do avoid the heart when we're shockwaving, but other than that, I have no concerns. So if we're shockwaving the lungs, what exactly are we shockwaving? Well, you can see here this little anatomic diagram. So we've got the ribs, obviously. We have several layers of muscles there, the intercostal muscles. There's a layer of fascia. We have the visceral pleura, the parietal pleura, and then we have the lung parenchyma. So as we're putting a trode over that area and sending the shockwave pulses through there, obviously the shockwave pulses are traveling through all those soft tissue structures, and I'm sure we're hitting some bone in the ribs as well. And then the majority of that energy of the shockwave is going to be released there at the air interface, because you're going to have air impedance of that shockwave that's passing through there. And so most of that shockwave is going to get distributed. Most of the energy is going to get distributed right there where that visceral pleura meets our lung parenchyma. So I'm not the first one to start shockwaving lungs. The first person I heard about doing it was Dr. Martin Allen down in Florida. He does mostly a standard race track practice. He also does some barrel racing horses down there. And he started treating horses with shockwave therapy of the lungs after they had an episode of epistaxis on the track. And usually he was treating those horses pretty immediately after, within a day or so. And he noticed that those horses, he was able to reduce or stop furosemide in many of those cases, and really didn't have a reason for it necessarily, but did notice that he thought it really seemed to make a difference. And so word of this kind of got out, and then Zomedica talked to me about doing a little bit more formal research on barrel racing horses to see if we could tell if it was really effective or not. Just a little background on EIPH. We'll talk about EIPH first, and then we'll transition over into asthma, and you'll see why here in a second. So there's basically 2 ways that we can affect EIPH and basically affect the pressures that are being transferred across the capillaries in the lungs. So one way is to minimize airway obstruction. So that's decreasing those negative pressures that are pulling on the outside of the capillaries. Those capillary walls are only a half a micron thick, so they're super thin, because they have to be elastic and able to allow efficient oxygen and CO2 transfer in and out of the lungs. So those horses, when they're running at full speed, they can take in 4 gallons of air per minute. So just huge negative pressures pulling there. On the other side, we have blood pumping through those capillaries with a heart that's beating at 4 times per second. And so we have these really high pressures pushing and these really high pressures pulling. So at some point, that exceeds the ability of the capillary to stretch, and then we get fissures in those capillaries, and blood leaks out, and we get our epistaxis, or our bleeding in the lungs. So how can we decrease or minimize airway obstruction? Well, the things that we have been studied so far, so we have nasal strips, so the flare strips I'm sure you're familiar with. At that point, we're decreasing airway obstruction or opening up the airways at the level of the nostrils. We can treat equine asthma syndrome. At that level, we're decreasing airway obstruction at the level of the lungs, the alveoli. And we can also correct upper airway dysfunction. So if we have a left laryngeal hemiplegia, for example, then we can help open those airways up, decrease airway obstruction at the level of the pharynx. So those are kind of just 3 broad categories that we can affect there. And then on the other side of the capillary, about the only thing we have available for that is treating with furosemide. So we're decreasing the circulating blood volume in order to decrease pressures that are pushing on the inside of those capillary beds. So furosemide is the most effective treatment we have for treating EIPH. A meta-analysis was performed back in 2015, quite a big study. So they looked at 405 total horses, and they found that they had a 68% efficacy rate as determined by decreasing the EIPH grade by at least 1 grade. So if the horse was, let's say, a grade 3 on endoscopy after they ran, and they were grade 2 after they were given furosemide, then that was a success. So we're looking at 68% 1 grade decrease. Another study was performed. This had fewer horses, 28 horses in it, but they looked at the horses over 4 different treatments, 4 different runs. 44 horses with the 4 observations. And they found a 64% efficacy rate in that study. So, with furosemide, we're looking somewhere in the mid-60 range as far as horses that are improving, as far as decreasing EIPH scores when running. The current study that we did that we're going to talk about, we're looking at barrel racing horses. Those horses we looked at within 48 hours of a run. So those had to be, typically they're running on Saturdays and Sundays. We'll look at the horses on Monday or Tuesday. Horses had to exhibit epistaxis or show symptoms of EIPH. We narrowed that down the further into the study we got, because we found that just allowing the barrel racers to say, "Oh, I think my horse bled," and then come in and enroll in the study, half the horses weren't bleeding. And so eventually we got to where we were only taking horses that exhibited epistaxis. The horses could run on Lasix or any other meds, but if they bled through them, they had to continue on the same meds without changing dosages. And they could not start on any other medications while they're on the study. Those are medications of Lasix or medications for asthma or anything else. We had those horses perform light work the first week, and then we had them return to repeat diagnostics on their next run, which had to be 2 to 4 weeks post the initial presentation. We did endoscopy on all the horses. We were screening for upper respiratory tract pathology. So if the horse had a grade 3 left laryngeal hemiplegia, or they had significant pathology in the pharynx, then the horses weren't allowed to be in the study. We also were doing blood scores in the trachea, mucus scores, and measuring septum thickness. We also ultrasounded the lungs on every horse. I was doing a pleural thickness grade, looking at, I just started noticing that a lot of the horses that were bleeding also had thickened pleura, especially in the caudal-dorsal lungs. So we're trying to correlate that to those horses that were responding, because we thought maybe we were having an effect on the pleura with the Shockwave. There was no correlation there. So we did the ultrasounds, but we didn't find a correlation between the horses that responded and the horses that didn't, based on their pleural thickness. And then we performed pre and post BALs in every horse. These were done blind, not with the scope. And we created a red blood cell grading system on the BAL fluid. This is our scoring system. It's a grade 0 to 4. 0 is obviously no blood. And then on the far right, you can see there, it looks like a jug stick basically on those samples that we graded a 4. We would only include grade 3s and 4s in the study. And so they had to be severe bleeders in order to be in the study. Our protocol, 750 shocks each. So we had 1,500 shocks total, left and right side. We were shocking the caudal dorsal lung fields. I would mark that area on ultrasound because I was already ultrasounding them. We were doing an E8 with a 80 millimeter trode at 480 hertz. So we were max energy, max frequency on those, and max depth. Now, I don't know how much the depth matters. If most of the energy is getting released, pretty, within an inch or two of the skin surface at the pleura, then it may not matter that we use 80 millimeter trode, but that's what we've used for all these cases. We did prep the skin with alcohol and used liberal amounts of ultrasound gel when we were treating, and we were doing a vertical intercostal pattern, so just going up and down, trying to go in between those rib spaces. Results, so we had 21 horses complete the trial. 9 horses were on Lasix. We had 13 horses that exhibited epistaxis. We had 20 screen fails. So those are horses that came in because the clients thought the horse was bleeding. We had a few cases that were bleeding, but they got kicked out because they had cicatrix or other things in the pharynx. But most of those horses were not bleeding, and the clients thought they were. So what I learned was that I think sometimes it gets overblamed for issues that horses are having when they're running off or not finishing a run or whatever. Then I think a lot of times I think the bleeding can get, or EIPH can get overblamed sometimes for those. Here's our results. So we had 76% of the horses improved at least one red blood cell score, and again, that's the BAL scoring system, not the tracheal endoscopy scoring system. We had 47%, so basically half the horses improved at least 2 scores. Every single horse that we performed did a BAL on, the first BAL had a neutrophilia. So they had increased neutrophils, that's defined by greater than 5%. And so those range from 7 to 38% neutrophils. We had 4 horses with increased mast cells, which would be greater than 2%. Then we had 2 horses with increased eosinophils, which would be greater than 2%. And what really was interesting to me when I started looking at all this data is that 67% of the horses that we treated improved at least 6% or more on their neutrophils on the BALs. So I thought that was really interesting, and we'll kind of show you why that's significant. There's a lot of numbers and data here, but I think we'll just go over kind of the big picture. So if you can see on the left, that's the far left is a red blood cell grading system. So grade 4, 3, 2, 1, 0. So that's how much those horses changed. And so at the top, we had one horse that went from a grade 4 to a grade 0. You can see that horse. It really did not have a change in neutrophils. There were about 12% on the first BAL and 12% on the second BAL. But then when you start looking below that, the horses that changed 3 grades and 2 grades, which are a fairly large group of horses, all those horses except for one had really significant decreases in the neutrophil counts on the BALs. So those are those groups there you can see that are highlighted in orange. Now, as we move down, we have the horses that did not respond as well. So either just changed 1 grade, which is an improvement, or didn't change at all. You can see the horses highlighted in blue. So those are the horses that had a neutrophil increase. Now, overall, we had one horse or several horses that increased a lot. But if you look at the horses that improved 1 grade but still had an increase in neutrophils, they had very mild increases. So 5, 5, and 6, as opposed to the group below them, which did not improve at all. We had pretty significant increase in neutrophil counts. So the big picture here, and again, if you look at the bottom, the red C means chronic and the L means Lasix. So a couple takeaways. One is that there's a lot more red C's at the bottom than the top. So the chronic horses did not improve as much as the acute horses. The chronic horses were ones that had had a previous episode of epistaxis prior to the run that they presented to the study for. Lasix was not that well correlated. We had some at the top, some at the bottom. So there really wasn't a big correlation on the horses with Lasix. But the biggest finding was that the horses who had a decrease in neutrophil count, especially the higher decreases, improved more on EIPH, and the horses that tended to not improve on their neutrophil counts did not improve. And so this was the big finding. Like I said, there's 67% of the horses that did improve on neutrophil counts in this study. So looking at the data, I started to think, okay, it looks to me like the horses that are getting better, their asthma is getting better, and we had more of those that didn't. So are we somehow affecting asthma by shockwave? And then secondary to that, the horses are bleeding less because we're decreasing the amount of airway obstruction in the airway. So I know sometimes your head can swim looking at cytokines and IL this and TNF that, but the takeaway from this is there's been three studies looking at cytokine regulation after shockwave therapy. The first one up upper left was a study done at Penn using an equine model, so a live horse model where they're shockwaving the cannon bone. The second study there on the right, that was a in vitro human macrophage model. And then the one on the bottom was looking at a cartilage rat model, so cartilage in the knees of rats. The big takeaway here is if you look at the orange highlighted cytokines, those are our inflammatory cytokines, are generally considered the more inflammatory cytokines. Those typically will recruit other inflammatory cells to the area. And so those were significantly downregulated in all three of those studies. So reducing the inflammatory cytokines. And they also showed increases in our anti-inflammatory cytokines, like IL-10 and IL-1RA. And so big takeaway from those are shockwave appears to decrease our inflammatory cytokines and increase our anti-inflammatory cytokines. All right, so this is, again, maybe too many numbers here with cytokines, but this is the pathway that we generally look at for increasing neutrophils in the airway. So if we have equine asthma syndrome, neutrophils are getting recruited to the airway, makes the horse cough, creates inflammation, creates mucus, so on and so on. So when dust particles come into the trachea, they get sensed by toll-like receptors. That sends a signal to the lymph nodes. In this case, we're talking about the Th17 lymph node. That then increases IL-17, TNF alpha, multiple cytokines that then go out and say, hey, neutrophils, come here, help us clean this up. And so then we got these neutrophils come to the lungs, and the problem is they don't just clean it up and leave, they stay. And so we get this ongoing cough that we see in our horses. So if we think about some of the cytokines we looked at on the previous slide, we have an upregulation of IL-1RA, so interleukin-1 receptor antagonist protein, and IL-10. Both of those downregulate Th17. And so we can see here that potentially shockwaving the lungs would help decrease recruitment of neutrophils to the lungs. And we also have, with our research that we showed on the previous page, decreases in those red markers as well. And so we can see a potential pathway of how potentially shockwave could be helping the asthma in these horses. So what are our asthma treatment options? There's more than this. I just wanted to kind of keep it fairly succinct. But the things we have in our arsenal, we have corticosteroids, obviously, dexamethasone, pred, like all the things we're familiar with there. We have our bronchodilators. We have our mast cell stabilizers. We have nebulized biologics. So those have really come on in the last few years. There's several being used out there. I think they're very interesting, have a lot of potential. We have our environmental controls, which is very important. And we also have diet modulation, omega-3 supplements, things like that can help as well, getting horses off round bells, decreasing dust in their environment, so on and so on. When we think about things we can regulate, symptomatically, we can decrease inflammation, hopefully decrease coughing that way. We can reduce bronchoconstriction with our bronchodilators. We can decrease mucus production potentially, but secondarily through regulating the inflammatory pathway. But are there ways we could affect gene regulation? And gene regulation, I'm talking about regulating expression of our cytokines, our different proteins in the pathways that can actually have some disease modifying effects, as opposed to just decreasing symptoms. We're actually affecting the expression of the disease and have a more long-term effect from that. So I think our biologics have that potential. So the ones I've used before, I've used both A2M and Regeniflex product nebulized through the airways and seen results with that. And so I think those have potential to to affect some of those pathways we talked about just a second ago. Then we have shockwave therapy, which we just talked about, and we have environmental controls as well, which can help decrease expression of some of those inflammatory pathways as well. So I think our goal should be to get to where we're treating these horses more at the biologic level of trying to change that local environment to a more anti-inflammatory environment versus just trying to decrease, open their airways up with bronchodilators and giving them steroids to decrease inflammation. So once I kind of had looked at all the data, realized, okay, it looks like there's something going on here with asthma in these horses with EIPH, we decided to do a little proof of concept trial to start treating some horses with Shockwave with asthma just to see what would happen. Before we did anything else, I just wanted, okay, let's just do at least 10 horses, see what happens. If it doesn't help them, then we'll just forget about it. So last summer, we took horses that had been coughing for at least 2 weeks. And that was kind of our marker. They had to have a consistent cough that the owner noticed. We performed 2 Shockwave treatments 1 week apart. And on this, we did the caudal, probably 70% of the lungs, might be 80%. We just tried to get as much lung surface as we could, avoiding the heart. We weren't going up over the scapula, but still, I think we were getting most of the lung surface there. We had 14 horses complete that trial. 3 of those were severe asthma, so those were heavy horses that had the obvious, the typical heave line and all that. And then we had 11 that were mild to moderate asthma. So those are horses that symptomatically were mainly just coughing. We weren't really seeing nasal flare or heaving on those horses. There was really not much lasting improvement on the severe asthma cases. Like one of the horses, they said helped for a week or two. Another one, they said it decreased the coughing for a few weeks, but nothing that was real significant. But on the horses that were just coughing and didn't have heaves, those were pretty profound. So 55% had at least 100% resolution within 2 weeks. So that was pretty astounding. I think 6 of the 11 horses within 2 weeks. So 1 week after the second treatment, quit coughing completely. And then 7 of the 11 horses improved at least 90%. So I thought that was pretty amazing too. And so based off this, we started a more formal study looking at doing endoscopy, BALs, all those things. So this study is ongoing. We started after the initial trial last summer, just to proof of concept. We started this more rigorous trial. But this one, we're doing obviously a physical exam on the horse, getting a history, getting a CBC, performing an endoscopy, and then performing a BAL. We're doing this at week 1 and week 4. We're doing 2 Shockwave treatments on these horses 2 weeks apart in the caudal lung, or really the whole lung. I guess I shouldn't say caudal, or get as much of that lung surface as we can. The difference in this study is we started doing 1,000 shocks on each side, as we're doing 750 on the EIPH trial, and we bumped up the number of shocks some for the asthma trial. We're doing a clinical score and a client scoring system on these horses. So we're looking at things like nasal flare, then we're looking at coughing at rest, coughing when work, things like that, and having the client score those things. And we're doing a score exam as well. We've had 10 that have completed the trial. We've had a couple more recently, but 5 of the 12 had 100% resolution of cough within 2 weeks. So that's similar to our trial we did last summer, where a significant number of those horses within 2 weeks had 100% resolution. If we look down below that, I kind of break down our percentages a little bit more. So 9 of the 12 horses had a 90% improvement at 4 weeks. So 1 month in, 9 of the 12 horses were at least 90% improved. We had 2 horses that were 50% improved. Those two horses both had increased mast cells, and so that seems to be, based on just the few we've had, that we get an improvement with horses with increased mast cells, but we don't get as much improvement as we get the horses that just have increased neutrophils. So we had one horse with 80% improvement, 290, and 7 with 100%. I did have my first horse that didn't respond today. I haven't had time to put it in here because I just did the 4-week follow-up today. That horse did not get better, but what we figured out was that we knew from the beginning the horse was on a round bale outside, and the horse was on the verge of kind of being a heavy horse the first time we looked at it, and now the horse does have heaves, and we know that based on the other horses we treated that this is not the best treatment for when you have your severe asthma heavy type horse. Sometimes we start getting in some different pathways for that, some added immune pathways, and so that horse did not respond. So we'll have one non-responder, but that horse kind of fits more into the severe asthma category. So just to summarize, for EIPH, we're seeing a 76% improvement, at least one grade on BAL score, and we had 47% of the horses improved at least 2 grades. If we looked at the study that earlier, we had 68% of horses that improved at least 1 grade on tracheal blood score with furosemide. So that study had 400 horses and we had 20. So obviously the numbers aren't that comparable, but still the percentages are pretty good on our study. Lasix had no correlation with improvement when combined with Shockwave. And with chronic EIPH, 60% of the horses improved at least 1 grade or more. And so as we get the chronic horses, as I said before, they're not improving as much as our more acute bleeders, but we are seeing improvement. We don't know for EIPH or earlier for asthma, what's the optimal treatment interval, what's the optimal dose and timing. So we had to set all those things and do them the same way every horse. So over time, we might find that there's a better interval or dosing regimen that works better. But so far, this has been successful. And are we treating EIPH by treating asthma? I'm pretty sure we are in our barrel racing horses. Now, there could be some other mechanisms involved in other parts of the country. Maybe those horses that Dr. Allen was treating in Florida, those race horses, there's a different mechanism of action there. But certainly, based on our BALs, I'm pretty confident that the horses that we're treating here in Texas, the barrel racing horses, that we're getting them better by getting their asthma better. As far as the asthma goes, we have seen a significant decrease in coughing from the Shockwave therapy. And we're basically looking, most of these horses are coughing when ridden. So almost all of them that we're looking at, they might be coughing some at rest, but it's mostly like with those horses, the client gets on them, they start hacking. They can't get a good ride because the horse can't quit coughing. It'll do better for a while, then they'll have to stop sort to hack. So that's kind of most of these horses are presenting like that. Most of these horses have a normal physical exam. I'm not hearing crackles and wheezes. I'm not hearing tracheal rattle, showing no symptoms. So the main thing we're looking at those horses is coughing when ridden. The proposed method of action, which obviously this is just theory still, is modulation of local gene expression of proteins in the asthma pathway. So looking at decreasing our inflammatory cytokines and increasing our anti-inflammatory cytokines on those horses. We do have the study is ongoing. We're hoping to get 30 horses or so in the next few months. We are looking at cytokine numbers in BAL fluid. So we're starting to save samples in hopes of getting that tested. So that would hopefully shed some light on what's going on in there as far as our gene expression of proteins. And again, I kind of combined our numbers here from the 2 different studies, the proof of concept and the one recently. 13 of 23 horses had 100% improvement in the 2 studies combined. 16 of 23 horses had 90 to 100% improvement. Again, that's improvement on coughing when ridden. And 21 of 23 horses had 50 to 100% improvement. So pretty phenomenal results. Like I said, severe asthma does not seem to respond as well as our mild to moderate. It doesn't seem to respond much at all. So I'm not encouraging people to try on their severe horses unless they just want to try it and see. I do have an associate that's treating some just to see what happens. But my results so far have not been great. But treating these horses that just start coughing, like when ridden, it's been pretty phenomenal on those cases so far. So hopefully we'll have a lot more numbers by the end of the summer, and we can give you all an update at some point on that.